Hi, my name is Cindy Gibson, and I'm an advocate supervisor on the Institutional Rights and Civil Liberties team. Our focus is on state hospitals, jails, and state-supported living centers. We investigate rights, complaints, and abuse and neglect, and our primary role is to ensure that our clients have the best quality of life that's free from abuse and neglect, and then when we can, moving folks out of the institutions into the communities. So we received a call from a guardian of a client in Lubbock, Texas. She was hospitalized at Sunrise Canyon, which is a local hospital there that's run by the local mental health authority. Our client was released from the hospital without a discharge plan. Our client suffered both from severe mental illness and an intellectual disability. So when she was released to a homeless shelter in the community, she did not do very well. In fact, when the guardian called us, she was missing from the homeless shelter. The guardian informed us that she stayed at the homeless shelter for less than an hour and then was reported missing. The client was found 12 hours later by the police. She was wandering the streets and she was in poor condition. Ultimately, she was rehospitalized. Our team got involved trying to force the local authority to come up with a realistic discharge plan that would maximize her chances for success in the community. And despite their objections and pushback, we were able to successfully get her an HCS waiver, which is a Medicaid waiver that allows people to live in group homes in the community and get the type of wraparound services they need to succeed. She's still in the community in the group home doing well. In addition, we filed complaints both with the Department of State Health Services and the Center for Medicare and Medicaid Services. Initially, the complaint wasn't substantiated, but after our appeal, the Center for Medicare and Medicaid Services substantiated the complaint and required an extensive plan of correction from Sunrise Canyon Hospital. They also are planning to do an enforcement visit to ensure that the plan of correction submitted by Sunrise Canyon is implemented. This allows for us to know that this will help other people in addition to Stacy who might find themselves in the same situation. We took this case because one of our priorities is that we provide assistance and advocacy for individuals to receive the services they need to remain in the community. We also looked at this as abuse and neglect and the failure to involve the client and significant others in her discharge plan. So, although there's multiple ways we can say that this is a priority, we feel it's a priority because we have an individual with a disability who was not given a chance to succeed and who was facing the real possibility of institutionalization had it not been for our advocacy for her to receive appropriate services.